Hi, my name is Amanda Rusco. This is my final presentation for Tested Measurements at Mid-America Christian University. TM is a 28-year-old Caucasian female who lives in Edmond, Oklahoma. She graduated from UCO with her bachelor's degree in child development. She currently works as a secretary at a doctor's office, where she takes care of insurance and scheduling appointments. She lives with her husband, her 7-year-old stepson, and her 2-year-old son. TM's presenting problem is that she feels like her anxiety is getting harder and harder to control. Recently, she's taken on more responsibilities at her job with a new doctor coming into the office. She says she used to love her job, but now she dreads waking up and going to her job every day. The added stress from her job has caused her to have panic attacks. During her panic attacks, she says her heart races, her chest hurts, she has trouble breathing, and she sometimes forgets to breathe during these attacks. She also cries during them. She says almost every day at work for the past few weeks, she's gone to the bathroom to cry because she feels so overwhelmed. TM describes herself as a perfectionist, and if she falls short of what she feels like is perfect at her job, she's very, very hard on herself. She says she feels like a failure as a mother and as a wife. She says she and her husband often have arguments about her stepson's behavior. 3 years ago, TM lost her stepfather to COPD. TM is very grief-stricken over the death of her stepfather. She was very close to him and feels like he was the parent in her life who loved her the most. She feels extreme grief and sadness whenever she thinks about him, and she thinks about him almost every day. TM says she sometimes thinks about death, but says her 2-year-old son is her motivation to keep going. Some background information on TM. TM was born in Ohio. Her parents were never married, so her parents split custody, and she lived back and forth between her two parents. From the ages from 2 to 5, she lived solely with her father. During this time, he sexually and physically abused her. When this was found out, TM moved in with her mother and new stepfather. Around the age of 9, TM was sexually abused by an uncle who would give her money and gifts to not tell anyone. She didn't tell anyone about this abuse until she was an adult. When TM was around 10 years old, her family all moved from Ohio to Oklahoma. She began school where she started to make friends and excel academically. She did very well in math. When TM started high school, she quickly rose to the top of the class in almost every subject and joined every organization she could, and also was highly involved in the church youth group. TM says this was the time in her life that she remembers that her perfectionism started to show. She would bring home a 99 grade paper and show her mother, and she would be proud of it, and her mother would say, "Well, why didn't you make a 100? When she did bring home those 100 papers, there was no praise, only more criticism. TM's mother began drinking alcohol, and she started to become physically and verbally abusive. When TM was 15, she told the school counselor about the abuse, and the school counselor reported it to the authorities. After this time, TM went into foster care until she graduated high school. After graduating college, TM married her first husband. They divorced after 2 years of marriage, after he became verbally abusive. Soon after her divorce, she met her current husband, and they had their son together. TM was given the MMPI-2. Her MMPI-2, TM scored high in most of the areas. On the validity scale, TM scored the highest on FB, faking bad. This score can indicate that she may be over-exaggerating some of her symptoms or that she was in severe distress. Her highest scores were on scale 4, psychopathic deviant, with a score of 79. These were closely followed by scale 2, depression, and scale 7, psychothenia, both with a score of 77. Overall, her MMPI scores indicate that TM may be severely depressed. She may have feelings of unworthiness and inadequacy. She may also suffer from chronic pain caused by stress. She may feel psychological turmoil and have feelings such as fear, anxiety, and depression. She may also have obsessive-compulsive symptoms and suffer from intrusive thoughts. She may also be sensitive to the opinions of others and may feel mistreated and blame others for her problems. TM was also given the MMSE exam, and she made a perfect score of 30. This test indicated that she has normal cognitive function. Some other medical conditions that TM has is hypothyroid disorder, and she takes medication for this. 1 year ago, she also had to have her gallbladder removed. TM's doctor has also prescribed her anti-anxiety medication, but TM says she does not like taking the medication because it causes her to have nightmares. Some possible diagnoses for TM are major depression disorder, generalized anxiety disorder, and panic disorder.